Welcome to Crush Medical Academy. I am Dr. Ahmed, your lead instructor. These are high-yield questions that you absolutely must know heading into your MCCQE1 or your USMLE examinations. In other words, you miss any of these questions and you risk failing. Make sure to like and subscribe to the channel, help us grow and put out more free content. Check us out at crushmedical.com where I have free study guide on how to ace the exams in 2026, a high-yield Anki deck, which is my bestseller, and along with a few additional premium services, including coaching and mentorship. Let's jump into the question. So we have a 42-year-old woman who's had multiple investigations, including multiple endoscopies and laparoscopies for chronic non-specific symptoms. All investigations have been normal. There is suspicion she is deliberately requesting these services without any external motivation for her behavior. Which of the following is the most likely diagnosis? So before we move forward with this question, I think it's a good idea to take a step back and kind of understand what's going on here. So we have a middle-aged woman who's undergoing multiple investigations. Everything is normal. There's two important things that obviously break this question open, right? The first thing is that there is suspicion she's doing this on purpose, right? That is very important. And the second thing is, it doesn't seem like there is any external motivation or benefit for this patient. So now that we've built that framework, let's kind of go through the options, okay? So option A, somatic symptom disorder, great option, but incorrect here, okay? So the real difference on how we can differentiate somatic symptom disorder from potentially what's going on here is somatic symptom disorder is they are not faking it, right? They are not deliberately producing the symptoms. They are in fact suffering and they are dealing with those somatic symptoms, right? And also they generally do feel like there is something wrong with them. So in this case, because in the clinical vignette, the patient we have, um, it seems like she is faking it, and option A, somatic symptom disorder, means that they are not faking it. That would rule that out, okay? Moving on to option B, illness anxiety disorder. Very buzzy, incorrect here. So this is where you have this preconception of something is wrong with you, despite very minimal or no physical or somatic symptoms, right? And in this context, they are also not deliberately fabricating it or making it up. So therefore, we can also rule out option B, okay? Option C, conversion disorder, also known as functional neurologic symptom disorder. Another very buzzy high yield diagnosis, which would be incorrect here. So this basically says neurological symptoms are incompatible with disease that arise unconsciously, not the deliberate behavior seen here, right? So how conversion disorder actually likes to present on the exams is they would say there is a patient who undergoes some stressor, whether that's a loss of job or a recent divorce or some financial hardships. Based on that stressor, they now develop some neurological functional disorder or deficits, right? So they might say they're experiencing blindness out of their left eye for the past 2 months or 2 weeks. Or they might also say that they're experiencing foot drop over the past several weeks since the onset of that stressor. And that's typically how conversion disorder, also known as functional neurologic disorder, would present on the boards, okay? In this context, it's the wrong option, okay? Moving forward, we have body dysmorphic disorder, another very high yield diagnosis, very buzzy. Students always love to choose this for some reason. In this case, it would also be incorrect here. And what body dysmorphic disorder is basically a patient has this preconception that they have some physical deficits that they are not satisfied with on a personal level. For example, you might see a patient, or in the question, you might see a patient who is coming to your clinic for nose procedure or requesting any plastic surgery for nose augmentation because she thinks it's imperfect, when in fact it's might just be perfectly normal without any health concerns. So these patients do typically have a history of Botox, skin, dermal injections, but also they love seeking cosmetic and facial reconstructive surgery or plastic surgeries. Okay, so be aware of that, and that is how body dysmorphic disorder typically presents. And that leaves us with our last option, also known as factitious disorder, which is the correct answer here, right? So factitious disorder is where someone is in fact faking symptoms deliberately, but there is no external reward or gain. So in this context, we have this patient who's coming in, she's requesting imaging, endoscopies, laparoscopies, despite everything being normal. and we've come to the conclusion she's doing this on purpose, but there is no external motivation, right? She's not getting off work, she's not getting some financial kickbacks or disability. So the question is, why do these patients do this? And that is what factitious disorder essentially is, right? It's somebody who falsifies or assumes a sick role without any secondary gain or benefit. And that is a very important distinction to be aware of, because if there was a secondary gain in the context of maybe a financial kickback or time off from work, now that would no longer be factitious disorder. We call this malingering, right? So now it's someone who pretends like they're dealing with flu or common cold or some viral illness, and then they're faking these symptoms, but they're also requesting time off work. We can say this is now malingering, and that is a very high yield diagnosis as well, okay? So that pretty much wraps up this question. Make sure to like and subscribe to this video, and stay tuned for more content.